I am ready.
Hey, here we go.
This meeting is being recorded.
Okay, so as Christy mentioned, I'll start just with our situation update. Not surprisingly, we are seeing record numbers of cases and record numbers of hospitalizations as is being seen across the region, across the state, and across the country. If we look at the Roanoke City Alleghany Health Districts, we've had almost 4,000 cases reported in the last week. So 3,700 cases plus. We are also at record high hospitalizations for residents of our district, standing at 140 hospitalizations for this past week. 103 of those hospitalizations are new hospitalizations. There is a silver lining here. The silver lining is that while we're seeing record number of new cases, clearly the hospitalization rate is not the same as we experience with our Delta surge or with our Alpha surge. And so this is a mixed bag here, and I think that we need to be transparent about that. But because so many people are sick, even though they're not requiring, not the same percentage of people are requiring hospitalizations, it still is putting a significant strain on our healthcare delivery systems, again, across our region, across the state, and across the country. And so it's really important for us to continue to do what we all know we need to do at this point. The other good news is that we're continuing to see interest in the vaccine, with over 5,000 people getting another vaccine in the last week. So we're seeing record high levels of disease activity, record high levels of hospitalizations, and we're continuing to see interest in the vaccine. So with that, I will open it up to any questions that you may have.
Dr. Morrow, it's Leanna Scicchetti with WDBJ7. I wanted to know, we heard the governor talk a little bit yesterday about the community testing clinics that will be joining those community vaccination clinics, like the one that we have at the Sears in the Roanoke Valley Mall. Do you have any other clear understanding of a timeline for that community testing center and when it could be available to people?
Yes, so what we know is that the state is doing a rollout. We've been in discussions with the state for several weeks now to try to get these, what we're calling the CTCs. Thank you for asking that question, Leanna. The community testing centers up and running. So I know I've been saying, I hope to have good news for us soon. I hope to have good news for us soon. We are in line. We are hopeful that we will have our testing center up and running by the beginning of next week. But because they're learning as they go, just as they onboarded the different CVCs over a matter of weeks, they're onboarding the CTCs over a matter of days. So they've really expedited the process, but we are a little, we have to wait our turn. So we're hesitant to give the specifics on it until we know for sure that the process is going smoothly. And, just for example, you can imagine some of the logistics that it takes to make sure that we've got the registration system up in place, that we've got a way for that registration to communicate with the lab, that the lab has capacity, and very importantly, that we have the ability to communicate with everybody back their results. So at this point, we're very, very hopeful that we'll be able to make a more concrete announcement by the end of this week for the beginning of next week. I ask for people's patience. In the meantime, we've added another large testing site to what we're doing. So we have a testing site going on right now at Salem. We have a testing site at Berglund tomorrow, and we have a testing site at Fincastle on Thursdays. And that information is on the various websites. It's on Facebook. So we are trying to we have increased our capacity here locally in anticipation of the CTCs. And hopefully by the end of the week, I'll have a more specific plan to provide to you. But you can imagine, we don't want to over promise and under deliver. So there's a question: are you concerned about that people will let their guard down too much since Omicron is not as severe, and with the relaxed rules going back to work, even if even if still not testing negative, will new testing be at the same place as the CDC? So right now, our plans are we're working with the same company that's helping us with our CVC. And our plan is to have the community testing center in a tent in the parking lot near the CVC. We're hoping that that will make it convenient for everyone. We know that that site has worked really, really well. We're planning at this point for people to drive up to the area, park, and then walk through a tent, because we really, with the positivity rates that we're seeing, if we look at last week's positivity rates, we were at 25 to 35% in our communities. We really don't want to mingle people getting tested and people getting vaccinated. So they will be physically separate sites, but co-located, if that makes sense. In terms of people letting their guard down, I think that it's really important for us to be transparent that COVID is everywhere. I assume at this point that everybody has been exposed to someone who's had COVID. And so I'm continuing to do what I can do to protect myself and protect my loved ones by wearing my mask. I'm protecting my loved ones when I'm wearing my mask and by keeping physical distance. And that's what I hope that most people are doing. Certainly looking around, a lot of people have let their guard down. And I think it's really important to understand that while Omicron does not have the same hospitalization rates and does not have the same mortality rates associated with it compared to other strains of COVID, it's still not fun to have. And what we're hearing is that people are still miserable, and it makes people stay home from work. It makes people stay home from school. So I hope that people aren't letting their guard down, because it's still having a significant impact on our communities. And there are still people being hospitalized. So we have 140 people in the hospital right now with COVID. That's not something to laugh at. That's not something to dismiss as being not severe. If that were your loved one, it wouldn't feel mild or less severe to you. So I think it's really important for us not to panic that we have 4,000 cases or almost 4,000 cases, and we can assume that the overwhelming majority of those are Omicron. We don't want to panic about that, but we want to still use common sense to stop ourselves from getting sick and our loved ones from getting sick.
Dr.
Another
Morrow,
follow-up
Sophia
question, Doc.
Borelli here.
Oh, sorry.
Go ahead, Sophia.
Oh, hey, Sophia with WDBJ7. Just wanted to see and ask if you have any specifics on how the current state of emergency that the governor just announced yesterday is going to affect VDH here locally. Is there anything that's going to be able to help with anything, or any specifics that you can add as to how that'll affect your department here locally?
Well, certainly the primary help that the executive order will have is for our hospitals, our healthcare delivery system. So when our healthcare delivery systems are decompressed, that helps us. When they're getting more support, that helps all of us. Specific to how this impacts us in public health, one of the things that we do that doesn't make the headlines is we do long-term care screening. So what this has allowed us to do is we've been doing that in person. We've been having some of our nurses go to individuals' homes and assess whether they need long-term care support. And it's a bit of a complicated program, and we can get more details if anyone's interested. But what that then, if we don't have to have our nurses go out to the homes, but actually do them remotely, we can use those nurses in that time, those opportunity costs, we can use those nurses to help with our COVID vaccination efforts, our COVID testing efforts, and all of the other things that help us in our COVID-19 response. So that's one concrete example. We are, like many places, trying to encourage people who can telework without compromising our ability to serve the public. We're trying to encourage that as well. We're trying to do everything that we're asking our community partners to do. in mitigating the risk of COVID-19. I think, Maggie, do you have a question?
I do. You know, some people may not be able to wait in line at those clinics held by VDH over the next few days, but really want to get a test because they know that they've been exposed. What advice do you give to those people who feel like they're kind of in a bind?
I wish that I had more access to testing for everyone in our community. We're just in such unprecedented times, just the fact that we have almost 4,000 people who tested positive. I mean, that's just the numerator. We know that a lot more people access testing. So that really shows you the demand for testing right now. And of course, it shows you how much disease we have in our community right now. I know that this is hard. I think that for people who can forego testing because either they're asymptomatic and they have the ability to stay home, or they're asymptomatic, they've had a close contact. If you don't have to get tested for work or school purposes, ride out those 5 days in your quarantine at home. And then you can return, while testing would be ideal on day 6 after 5 days. At this point, we simply just don't have enough testing capacity. So I would encourage people, if they're asymptomatic and they're seeking testing because they've been exposed, hunker down for those 5 days of quarantine, put on your mask, wear it properly, and you can go back to work, back to school on day 6. Those are the newest guidelines from CDC. In the ideal world, we would test people, but we're not living in the ideal world right now. We don't have access to testing for everyone. And so this is a compromise, but it is predicated on our ability to properly wear a mask. And that reminds me, one thing that I didn't say that I think is really important for everyone to understand. We need to be clear about expectations. And if you have tested positive for COVID, don't expect for us to be able to call you and walk you through the contact tracing and case investigations, helping you identify people who you may have had close contact with. There's simply no way for any health department to stay current with contact tracing and case investigations at this point. It's just not possible. And so we really are looking to the public to do their own contact tracing. I think everyone understands how critical it is, if you do have COVID, to let the people who you've had close contact with know, so that they can do their best to follow the quarantine guidelines. And I think most importantly, if they develop symptoms, be aware that they are likely to have COVID. I think we should all assume that we've been exposed. I think we should all assume that if we have cold-like symptoms, if we get a fever, it's very likely at this point that you have COVID. And so we have to be clear that the expectation is that contact tracing and case investigations at this point, it's just not feasible. We do not have the staffing to do that. And the question is, when there's this much community transmission, we need to focus our efforts on the highest risk situations. So outbreaks in long-term care facilities or in our correctional facilities, we really have to prioritize the highest risk and spend our energy on helping those facilities protect the people in their care.
And Dr. Morrow, this is Evan Johnson, WFXR. Kind of a follow-up to what you were saying about the increase in demand for testing. As you said, there's a testing site in Salem today, and we're hearing that there is an extremely long line of cars there, and people are being told they may not get the opportunity to test because there are only 400 tests available. Can you speak to whether VDH is looking into supplying more tests at their different testing centers? Or I know you mentioned earlier you all are encouraging people, if they're asymptomatic, to go ahead and quarantine for 5 days and try to avoid testing. But are there any talks of increasing the number of tests available at these different sites across the area?
So one of the challenges that we're all facing is simply capacity. And so I know I mentioned this last week, but we're really thankful that we have a wonderful lab in our community, Fralin, and Fralin has been at our side. We are partners in this, working together to try to get as many people tested as possible. But all labs have capacity issues. So our numbers, the numbers that we are doing at any given site, so 400 today, 350 tomorrow, 250 on Thursday, those are numbers that we work with the lab to try to balance the public need with the actual capacity. We're very hopeful that by Thursday, Friday, we'll be able to announce expanded testing capacity starting early next week. But I really don't want to overpromise and underdeliver. I really need to make sure that everything's in place before we make those public announcements. I assure you that once we are confident that we'll be able to meet the public's need, well, maybe not meet the public's needs, but expand our testing capacity, we will make that announcement as soon as we possibly can.
Okay, and then another quick follow-up. We were talking about masks earlier, and we know that, well, now we're hearing that the cloth masks may not necessarily work for so to speak. People are being encouraged to get their hands on the KN95 mask or the N95 mask. Can you talk at all about whether the cloth masks are appropriate, or should we go ahead and get these K95 and N95 masks?
Well, I think it's really important to be aware that N95s really are considered the medical grade masks that are intended to protect the person from inhaling microparticles, basically. That's sort of a simplified way of looking at it. And they need to be properly fitted. There's something called fit testing. And the KN95s are sort of the compromise of having a higher quality mask that's available. If people have access to them, that's great. In the meantime, I think that what is the most important thing is having, even if it's a cloth mask, having at least 3 layers. We've talked about that. There's a saying that if you hold it up and you can see light through it, it's not ideal. But one of the things that I think is even more important is that it has to be properly fitted. We all have seen people walking around with their masks under their nose, or taking their mask off when they're talking. It's having a properly fitted mask. I would rather have someone wear a properly fitted cloth mask that's thick, that has 3 layers, than a KN95 that's hanging below their nose. So it's that fine detail of making sure that people are wearing their masks properly. That to me is number one. And if you only have access to a cloth mask, again, hopefully 3-ply with elastic around it, so it's very well fitted around your nose, your cheeks, your chin. That's better than nothing. We know that the cloth masks are effective at preventing those large droplets from getting out into the air. Are they effective at getting microscopic particles out? No, they're really built to prevent us from, when I'm talking respiratory droplets, I'm expiring respiratory droplets, and the masks are effective. Even the 3-ply cloth masks are effective at preventing those from spreading. So in the ideal world, everybody could wear a KN95 that is properly fitted. As I mentioned earlier, we're not in an ideal world, and I would far rather see more people wearing any kind of mask as long as it's properly fitted than really sticking to only KN95s. It's that combination that's so important. I do see a question in the chat about reports of people swabbing their mouth instead of their nose. Is there any benefit to doing this, or is it recommended? Every test comes with specific directions for how the sample needs to be obtained to maximize or optimize the results from that particular test kit. And so, there are some that we call anterior, the front of the nose, some that are in the middle of the nose, the mid-turbinates, and some that are up higher in the nose. And they've all been tested, they've all been validated. The most important thing is that you follow the directions for the test kit that is in front of you. And I'm not aware of any that have been improved for mouth swabs. So I hope that answers that question.
Yeah, time for one more question.
Dr. Morrow, Sophia Borelli again. Just, we've been talking a lot about testing and those demands. Want to know, are you seeing the demands met? I mean, you're giving out 400 today. Do you think that those will all be given out? Talk just a little bit about the demand for the testing that we're seeing here in our areas and why you guys are hoping to expand that as well.
Yeah, there's no question that we are currently in a situation where demand outstrips supply. So I had checked in around 10:30, I think it was, or 10:15 to see how we were doing at our site in Salem. And we had a huge line. We had people waiting there at 8 a.m. for a 9 a.m. start, excuse me. We know that we've turned away hundreds of cars. We're trying to minimize that by carefully counting people as they come in. We know how many tests we have available so that people don't wait in line and then find out that we don't have that test available. But it's imperfect, and we know that there have been people who have waited, who've had to be turned away. And so we know for sure that across our regions, our health districts, across the region, across the state, the demand for testing right now exceeds the supply. And that's why it's really important for us to expand it where we can, working with our labs, if we get more home kits, we will distribute more home kits. There's no question that supply exceeds demand right now, and we're doing everything that we can to optimize that supply and try to get it delivered as equitably as possible.
Thank you all for joining us this week. We appreciate it. I will get this video optimized and get it back out to you. If you have any follow-up questions, you can send them to me.